Good afternoon. Thank you for tuning in to the Health and Wellness Hour right here on the People Station with your favorite gerontologist, Dr. Macy Smith. Today's show is sponsored by MUSC Health Orangeburg. Today I'm joined with neurologist Dr. Tushar Trivedi. Dr. Trivedi, thank you for being here today.
Absolutely, it's my pleasure.
Wonderful. So you're a neurologist, but many people still don't know what a neurologist is or what a neurologist does. Can you tell our listeners what it is that you do and when they should possibly get in contact with you?
Yeah, absolutely. So I'm a neurologist. That means I'm a brain doctor. I deal with conditions which are because of brain problems. I am subspecialized in stroke, which is a condition which affects the blood vessels of the brain. I see patients both on the hospital side and in the clinic.
So let me ask you about this because you mentioned stroke. So I'm a gerontologist, so I work a lot with those who are living with Alzheimer's and dementia. And as you know, because I'm getting ready to preach to the choir on this one, dementia is caused by several different conditions. And one of those conditions, which data supports is the second largest cause of dementia, which is vascular disease and stroke activity. Now, what are some signs and symptoms of someone possibly having a stroke? Because people can have many strokes, correct?
That is right. So again, yeah, stroke is a condition which affects the blood vessels of the brain. There can be different types of strokes. One of the common type of stroke that we see is called ischemic stroke. That means there's a blockade in the blood vessel of the brain. Another type of stroke is called hemorrhagic stroke, where there is actually a rupture of a blood vessel in the brain and there's a bleed inside the brain. That's the second most common type of stroke. When someone has a stroke, they would have different symptoms. Typically, we use acronym to educate the general population. It's called BFAST.
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 Okay.
B stands for balance. People can have problems with balance, specifically having symptoms of dizziness or vertigo.
Oh, that's interesting because I never even thought about vertigo and balance with stroke activity, so that's good.
That's right. E stands for eye problems, sudden loss of vision on one side, either left or right. That can be a stroke symptoms. For the FAST, F stands for face. Droop on one side of the face can be a symptom of stroke. A stands for strength in the arm or leg actually. So weakness on one side of the body, either arm or leg, can be a stroke symptom. S stands for speech, either having slurred speech or difficulty in getting words out can be a stroke symptom. And the last word, letter T, is absolutely very important. Time is extremely crucial because once someone is suffering with stroke symptoms, the clock starts.
Oh gosh.
Every minute the stroke is untreated can lead to injury of about 1.5 million neurons in the brain. So we want, when someone, a patient, a family member, a friend is suffering with stroke, for them to come to the hospital immediately, because in the first few hours there's a lot we can do. We can give medications to reverse the stroke symptoms. We can also offer surgery where a surgeon can go with a catheter and pull the clot out.
Oh, wow. I mean, you're like magical. So that's important. We're going to take a break. When we come back, Dr. Trivedi, because you've really provided just some basic information that's life-changing based on what I'm hearing now. So when we come back from break, I want you to talk about some of the things that people can do to prevent from getting a stroke. So some of those preventative measures. So we'll be right back. It's the People Station. Welcome back to the Health and Wellness Hour. We're still chatting with Dr. Trivedi about brain health. You're a neurologist, and you were speaking earlier about the signs and symptoms of a stroke. We're familiar with FAST, but you added some sauce on that thing. You said be fast, the balance and the vision. That's important to know, and the timing is another key issue, being able to get to the hospital or to medical care immediately. Now, what are some things that people can do to even prevent from getting into that state?
So stroke shares a lot of risk factors similar to cardiovascular conditions, heart diseases. So some of the common risk factors for the stroke are high blood pressure. That's one of the most important cause of strokes, both ischemic and hemorrhagic strokes. Diabetes is another common risk factor. Smoking is an important risk factor because it damages blood vessels all over in the body, including the brain and heart. Smoking is an important risk factor for stroke. Being overweight or obese is an important risk factor for a stroke. Lack of physical activity can be a risk factor for a stroke. Having a bad cholesterol profile, particularly if your bad cholesterol numbers, which is called LDL, is high, that can be a risk factor for a stroke.
So is LDL, and what's the other one?
So HDL is called good cholesterol.
Yeah, my daddy will say that all the time. Oh, baby, my good cholesterol is high, but it's good. And I'm like, I don't know if that's accurate, but.
So we want the HDL, the good cholesterol, to be high because it is protective.
Okay.
And the bad cholesterol, LDL, to be low.
Okay, good. Now, all of those conditions does increase someone's risk of developing stroke activity, could also develop brain damage, and everything that you mentioned can be addressed. You know, living a healthier lifestyle, exercise, get out. Also, in terms of brain health, is there anything someone can do for their cognitive health to prevent, neurological changes?
Absolutely. So just both for stroke and brain health in general, there are a few things that we recommend. Firstly, if you have any of the risk factors, hypertension, high blood pressure, diabetes, you should see your primary doctor regularly so they can manage those risk factors, keep them under control. Other things that we can do on our day-to-day life is stay physically active. Any form of exercise, even brisk walking is a very good form of exercise. Right. 20 to 30 minutes walk.
So they don't have to run a marathon. They can just walk in the neighborhood.
Absolutely. Yes, just 20 to 30 minutes walk has been shown to decrease the risk of stroke and heart attacks. Eating a healthy diet is very important. I typically recommend my patients to eat Mediterranean style diet.
Yes. I do that.
Yeah, that has shown to decrease the risk of stroke, heart attacks, as well as dementia. And when I like to break it down when I say Mediterranean diet, typically I would recommend using extra virgin olive oil as a cooking oil because it has good essential fatty acids, which are good for cardiovascular health. Cutting down on fried food, extremely. We are in South, we like a lot of fried food.
Well, I can't cook that well anyway, so I'm good.
Yeah, once in a while is okay, but not on daily or weekly basis. Cutting down on starchy food or carbohydrates is very important because they go in the body, turns into glucose. So cutting down on white rice, white bread, and pasta. A small portion of brown rice or whole grain bread is okay, but not a large amount.
Yes, sir. I like that.
Fruits and vegetables, I encourage my patients to eat a lot of fruits and vegetables. Also, nuts like almonds, walnuts are really good for cardiovascular health and brain health.
Wonderful. And this is stuff that we could take advantage of today. So thank you for breaking those things down for us. Now we're going to take a break. When we come back, we want you to talk about how folks can get in contact with you and how often they should see a neurologist. We'll be right back. Welcome back to the Health and Wellness Hour. Thank you for sticking it out with us. We're chatting with Dr. Trivedi. He's talking to us about overall brain health and how to reduce those chronic illnesses and those comorbid conditions that could lead to brain health conditions and also dementia, which is what I talk about a lot. Now, when should someone see a neurologist? Should that be a part of their annual checkup?
Not necessarily. Neurological conditions are extremely prevalent. Conditions like stroke, mini stroke, dementia, or any form of cognitive impairment, other conditions like Parkinson's, epilepsy, multiple sclerosis. These things are very common in general population. So if someone is suffering from any of these ailments, they should see a neurologist on a regular basis.
When you say regular, what do you mean by that?
It depends on the
person.
Depends on the condition and the person. So firstly, if you have any of these conditions, you should talk with your primary care physician. They are the first point of contact that can make referrals for you to see a neurologist. And other ways to schedule an appointment is to call the clinic directly. Our number is 803-395-3044. Also, if you use MyChart, you can make an appointment through using the app, MyChart app, or you can go to our website, muschealth.org. You can schedule an appointment through that as well.
Wonderful. So you're very accessible to our community. I'm excited to have you here. I'm from the area. I've been born, raised here, and we have not had a neurology clinic readily available to our community, which suffers a lot from those conditions that you named. Now, some people are afraid to come to a neurologist because, you know, they don't think a neurologist is like their primary care doctor. They don't be touching on them and they're not as friendly. You know, that's what the streets say. I'm not saying that, but that's what the streets say. But, you know, they're afraid because the last thing they want to have happen is something to happen to their mind or their brain. How can you make people feel comfortable coming to you, per se?
Firstly, I think neurologists are very friendly.
Yes,
That notion should go away. That
Right. For the record, you are very friendly.
Yeah. Secondly, I think all the neurological conditions, it's important to recognize them early, because if we recognize a condition early, there's a lot we can do to stop the progression of the condition.
Yeah. And I do know, of course, if someone is diagnosed with a progressive type of dementia like Alzheimer's disease or even vascular dementia, early detection is still ideal because you could treat the symptoms. And I tend to, neurologist is a part of my, I would say my comprehensive care plan for my patients. Do you feel like you have the resources that you need outside of the medical model to be able to share with families, or is that an area of need in your opinion?
I think that's an area of need. There's a lot we can do in that area.
Yeah, well, I'm going to try my best to help out with that. Thank you so much for
Absolutely,
joining us today for the Health and Wellness Hour. And thank you all for joining us. Until next time, the Health and Wellness Hour is sponsored by MUSC Health Orangeburg. See you next time.